Immunologist Peter Doherty won a Nobel Prize in 1996 for his research in the role of T cells in the immune system. His latest book, released last year, is called Pandemics, What Everyone Needs to Know, and he joins us now from Melbourne. Peter Doherty, thanks very much for coming on.
Pleasure.
You've admitted that you underestimated how quickly Ebola would spread through West Africa with this outbreak. What did you get wrong on that one?
I think we all got it wrong, really. We've had Ebola around since 1976, and I think there were a couple of thousand severe cases up till the present outbreak, and now we've had more than 4,000 deaths. And I think everyone thought that because it's such a severe disease, so obvious and so horrific, that we'd jump on it very quickly, practice barrier nursing, isolation, quarantine, and control it. And that had happened previously in Africa with substantial input from both Europe and from the American Centers for Disease Control, the CDC. This time, boots weren't on the ground as quickly as they might have been. The virus got away. And as was mentioned earlier in the program, the social infrastructure, poverty, information and so forth was distinctly lacking. And as a result, the thing has continued to spread.
And there is a sense of crisis in the US at the moment. The President has cancelled his travel plans to oversee the response to those revelations that a second nurse in Dallas has tested positive to Ebola. How great a crisis is this for the US?
I think to some extent that's a political crisis. It shouldn't have happened that we got an index case in Dallas and then 2 nurses infected. Where the flaws were, we know that information wasn't properly passed on from the nurse who took the initial history to the doctors, and then it seems that we didn't have a federal presence there quickly to oversee what was going on in that hospital. That's all changed, and now the CDC is fully energised. You know, the Americans have the United States Public Health Service, which is federal, extremely well organised, a uniform corps that responds to these types of things. The case of her flying on a plane, it's very unlikely that you would get significant spread, but it's possible. And
yeah, sorry to interrupt. How much of a crisis, though, for those West African nations?
Horrific crisis for the West African nations because it's continuing to spread. It's not slowing. It's been accelerating since March of this year. And there are all sorts of factors there, such as patients leaving hospital, being hidden away. And when you say it's not that infectious, there's one case at least of an alternative medicine practitioner who died and infected because the practice of touching the body exists in the particular community, infected 33 people. So with contact, it can be extremely infectious.
Professor, how urgently do people have to act? Because we've had this debate between we want to ensure that things are safe for the people who go in to help, but action is needed within the next 60 days. Are the next 60 days particularly critical, or is there a long-term war on now?
I think there's a substantial long-term battle on. Of course, the sooner we can react and react with real strength, the better. I think Doctors Without Borders was asking for more medical personnel. They've been fantastic. They're a charity, and they've really taken the heavy lifting with this. It shouldn't have been left to them and to the missionary activities. There should have been much greater involvement of governments from elsewhere and so forth much more quickly. And I disagree a little bit with Tom Switzer. I mean, it's great the US is so involved, but why does everything still fall on the United States? There are many other wealthy countries now in the world, and wealth has moved, and we need something more like a global response to these things. I think we can learn a lot from this outbreak and organise ourselves a lot better. It's also a fact that we could have had a vaccine and probably could have had drugs if we'd had the mechanisms for getting those, or the funding for getting those products through, because they've been under development for some time.
Peter, in fact, sorry, Tom, go.
Yeah, Professor Tom Switzer from Brisbane. The US Centers for Prevention and Disease Control put out a model that said that by mid-2015, so mid-next year, the number of people affected will rise to something like 1.5 million people. Do you think that's true?
Well, we hope not, Tom. And, but, of course, that's their projection, presumably, on what's happening at the moment. And it certainly is an extremely dangerous situation. And, of course, as we both realise, that will have enormous economic effects. It's not just humanitarian, it's also economic. We hope, though, that we can get a vaccine in there much more quickly. There was a vaccine pretty much, I think, ready to go for final testing in 2010. There are also various drugs under development. The problem is they haven't really been tested for safety testing and all the rest of it. We've got a model where often these sorts of products are developed in academic institutions, and then if they're to be taken through to use or to practicality, we need the involvement of the pharmaceutical, big pharma industries. And of course, there's been no economic motive for them to do that. We need a new model that actually funds this sort of stuff, and so we're much better prepared. I think there's a possibility we may have a vaccine by the end of the year.
Wow.
You wrote recently, Professor, about how a virus like this tests the robustness of the public health system. To what extent do you think that situations like this highlight the need for greater investment in well-organised public health systems?
I'm not sure. I've been wondering. There have been cutbacks to the CDC, which is the primary arm that has been so effective against diseases like Ebola. They're almost like, you think of them like the US Marines going in, the CDC goes in. And they have been cut back. You know, what's happening in the Western societies, including our societies, we're having to face substantial cutbacks in public funding for various reasons. I think public health is one thing that has to be in the public domain, and we have to resource it properly. I think this whole experience should cause us to look again at how we handle these threats. We are okay at dealing with the things we know about, but we hadn't really appreciated what a threat Ebola is, and we all underestimated it.
And just finally, the opposition is calling for the government to send personnel to West African nations. What do you think Australia should be doing?
I think we'll inevitably have to put more resources in one way or another. If we can't put more personnel in for whatever reason the government suggests, then I think we'll have to put more money in. If we do get a vaccine, for instance, think of the cost of getting that out there to West Africans. You know, West Africans still die from yellow fever, and there's been a wonderful vaccine for that around since the 1950s. Lack of resources is a major problem in this.